Thank you for that great introduction. Thank you, everyone, for coming out today. It's a pleasure to be here and to help kick off the annual series. So, today I want to talk about a relatively new project. Some results are hot off the presses. And I want to take you through the motivations for the project, the innovations that we're trying to make in methods, and then some of the findings that we have so far. So the larger motivations for the data collection project, um, there are two main things. One is better understanding family contexts. So you'll see as I take you through this, I've been thinking a lot about better aligning our theories about family contexts and how they shape family members' health and well-being, how our data can better serve testing our theories that we have about this and the ways that we've been limited by data to this point. And so two important components of that. One is there's a lot of work these days on complex families and looking at how families are much more likely to be spread across households and involve members outside of what's been thought of as sort of the standard nuclear family, right? And then second, thinking a lot about interactional dynamics, like a lot of what social scientists have studied about families, demographers, sociologists, has leaned heavily towards family structure and kind of static kind of measures of what families look like. But what's happening in the interactions between those members of family? So, and then second, taking all of that, I'm interested in linking family context to maternal prenatal health, especially through pathways of support and stress. So, if we think about the kind of motivating ideas here, I want to talk both about theory and data and methods kind of at the same time and go kind of marching through history and thinking about what we tend to do when we study families. So I have in a lighter color here under theory in quotes, family as a unity of interacting personalities, which is the title of an article by Ernest Burgess in 1926. But around the same time, there are these, this strong influence of structural functionalism, and maybe think of Parsons' work. And so I feel like Burgess had these really interesting ideas about how families are more than just who's in the family and the structure, but also how those people interact with each other. And Burgess also talks about it's not just the dyads and kind of what's flowing between two people in a family, but the kind of larger sense of what's the identity of the family and the kind of ethos in the family and so on. So some really interesting ideas that then I feel like kind of bump up against this heavy influence of structural functionalism, but also the rise of social surveys. And surveys were so often household based. And so I think it's both theory and methods coming together in a way that's like, well, we'll figure out who all's in the household and what their relationships are to each other and have these measures of family structure, but maybe not as many measures of the interacting personalities. So the data and methods, the emphasis is on this nuclear, or some people talk about the SNAF or SNAF, which is standard nuclear American family structure. And of course, there have been, moving through time, theoretical developments that push us more towards sort of conflict theory and critical race or feminist perspectives, intersectional approaches. And so that happens to some extent with survey data that we have. Also, I've mentioned again, complex families and the desire to know more about, especially extended family who might be very involved in day-to-day family interactions and exchanges, maybe within the household, maybe nearby, but not in the same household. And so what do we do with all these sort of encouragement to think outside of the nuclear family and to think more about types of interactions? I mean, here's just a visual to think about the typical survey approach. This is an image of a standard household roster. This comes from a Nebraska survey. But you can see it sort of lists person 1, person 2, all the way down to person 8 in a household. It gets their relationship to the respondent, their age, date of birth, sex. So you have some demographic information about them. You know who they live with, you know what their relationship is. So you can kind of understand the family structure and also kind of demographic characteristics of family. So you can ascertain to some extent kind of roles in a family or a household, relationships, demographics. And then occasionally a survey might go past this and also collect data on specific family members, like spouses, partners, and children are most common, sometimes parents. Again, getting demographics, but sometimes you get relationship quality. So intimate partner relationship quality or parent-child relationship quality shows up in a number of surveys. And sometimes we see this addition of global measures of family support or stress. So there are classic questions that ask about how well does your family get along with each other, or how much conflict is there, how much do you argue, but it's always asked about the family. And so it's not able to capture nuances or ambivalence. Everyone knows families are complicated. So we have people in our families we get along with and people in our families we don't get along with. So asking a global question like that, you may not get at those nuances. Other limitations to this, clearly, we might miss influential family members who live in other households if we're not collecting that information. Little information on the quality of ties and interactions. And what I just said, rarely do we capture this relational ambivalence. Different kinds of properties of relationships can be both sort of positive and negative. So I'm not alone in sort of thinking about these limitations. I just grabbed a couple of quotes. The first one is from Frank Furstenberg in 2020. You know, every decade, the Journal of Marriage and Family does these reviews of family research, and his was focused on the extent to which extended kin are considered in family research. So he's saying, you know, it's difficult to collect data on relations with extended kin. And so we've underestimated their significance in the everyday life of families. And then these second two in the blue come from the two most recent JMF reviews on families and health specifically. And so Carr and Springer in 2010 are saying one of the most ironic limitations of studies on families and health is that most focus on one individual within the larger family network. The limitation is due in part to traditional models of data collection. So we recognize that we're bumping up against, we'd like to do more complicated things, but we don't always have the data. And then Umberson and Tomier in 2020, a very similar, we would benefit from more studies that include multiple family members. So I designed a study to try to take this into account. Oh, let me just also acknowledge, back to the slide about kind of through time, how we think about things and how we measure things. Also, there has been a good bit of really great ethnographic observation or interviewing type studies that handle the interaction of family members and the complexity much better. They can focus in intensely on cases. And I think classically of Carol Stack's work, and then Linda Burton and Kathy Eden and so on, we have really good information about like in-depth certain kinds of families. But how can surveys evolve to do the same thing? How can we get a more kind of general population representative sense of how these things work as well? So my idea is to take a family network approach. So the theory that I'm leaning on here is, I'm back to Burgess and thinking about how he was talking about these interacting personalities in family units within and beyond households, and not just the dyads and what's happening between them, but also just a general, like if someone's understanding of their family and what the identity of that family is. And I'm mixing that with social network theories and relational sociology perspective, because those bring in this idea of how to think about life truly as made up of these interactions, and the qualities of those interactions, and then being able to measure that in a social network approach that lets you think about kind of the structure of the network and various attributes of the ties in that network. So what I'm going to talk about today is called the Family Matters Study. And this does also build off, I want to acknowledge Eric Widmer, who is in Switzerland, a sociologist, and he has written a book about what he calls a family network method. And so he's been involved in a variety of studies. They tend to be smaller N studies and kind of focus on special populations, maybe around certain types of disability or health conditions and how families operate in these specific situations. But I drew a lot from what he had been doing with his colleagues and the kinds of questionnaires they were using. So pulling it together and bringing the family network approach back to thinking about maternal health. This study is designed to think about the family networks of pregnant people and how their characteristics will relate to health during pregnancy. So I'm going to talk generally about 3 research questions here. One is, how do pregnant people self-define their family network? So what happens when we ask people to tell us who's in their family? What do we get? And what might we want to think about going forward with these kinds of methods? Second, what can a family network approach tell us about families? So what new kinds of things do these data show us that a typical household or family survey might not? And third, then I'll try to show you some preliminary, hopefully we'll have time to get to some regression results to look at some of these characteristics of family networks and how they relate to. Today, I'm actually just going to show you results for prenatal distress, but I can talk about what we're seeing with depressive symptoms if I have time. So the Family Matters Study. So this was funded by an R21 grant from NICHD that was, the money arrived in March of 2020. So guess what else was happening in March of 2020? It was really kind of difficult to get the data collection off the ground because of COVID and because our plan was to be recruiting pregnant people in prenatal clinics at appointments. And if you recall, a lot of people weren't going to their appointments in the height of COVID. Also, we had arranged and we had permission to work with a really great research team that had been put together by a OBGYN MD at UNC who did a lot of research. And he had a team of research nurses who spent time in these prenatal clinics locally and were really well trained on how to recruit respondents. And so we were working with them to be able to do that. But then they were also, the plan was actually to recruit them and then ask them to do the interview right then and there in a room in the clinic. But clinics were shutting down. And even when they started opening up, they didn't want extra people there in rooms in person doing. So we had to shift, and we decided to go ahead and do our survey interviews on Zoom. So the recruitment started as these nurses trying to recruit participants who had come in for prenatal appointments and who were in about their 2nd trimester of pregnancy, to then give their contact information so that one of our interviewers within 24 hours could reach back out and say, let's schedule a time to do an interview on Zoom. That ended up going a lot slower than we anticipated. And we had a hard time getting those nurse researchers to not just go to one particular clinic that's in Chapel Hill, North Carolina, that has midwives. And so, as you can imagine, it's a very select population who show up for their prenatal appointments there. And so we were frustrated with not having a very diverse set of respondents. So we pivoted a bit, and we also started, so this was, the recruitment was within one healthcare system in North Carolina. And we arranged to have permission to get into the medical record data and find week by week people who had prenatal appointments anywhere in the state with a provider in this particular health system, and we sent them letters that invited them to participate in the study. And if they were interested, they could email or call or go to a website and let us know they were interested. So we had staff watching those various modes of communication and trying to immediately connect with whoever was interested. So we ended up recruiting 151 pregnant people in clinics and then 261 from this mail effort. The response rate, just sort of a generic, like what percent of people that we asked said yes and made it all the way through sort of consenting and participating. We got about 16% response rate in clinic and about 5% response rate via mail. And as you can imagine, the male participants are more diverse. But I'll talk a bit in a second about what the sample looks like. I said we did these interviews on Zoom. We used a software called EgoWeb 2.0, which some of you may be familiar with. It's a fairly common software available to use when you're doing these kind of social network interviews. That's really designed to more easily kind of get the lists of people in a network and then ask questions that apply to all those people in a sort of efficient way. So I have this picture showing two people talking on Zoom. This might be how the interview started, but eventually the interviewer shares the screen and it has the EgoWeb screen on it. And so you'll see some examples of that in a second. Sample demographics. So it does end up being more advantaged sociodemographically or economically sample. About 67% have 4-year degree or higher, 58% own or are buying a home, 33% rent, 28% on Medicaid or have no health insurance. So we have variance. It's just not, representative of, it wasn't designed to be representative of any sort of general population. We just wanted to try to ensure that we had a good bit of variance across groups for these variables to be able to do some comparisons, but not to make probability-based estimates of how things are related or what characteristics people have. And a couple of other components of the study, because I love doing mixed methods work and because I knew that we would benefit from a qualitative component here, a subset of the survey respondents were recruited to have a slightly longer interview where the end of it would be these open-ended follow-up questions. And I'll talk some more about those in a bit. It added about 20 minutes to what was about a 45-minute Zoom interview for just the survey part of it. Also, we have been able to get electronic medical records for all the participants. We have access to the system. Of course, we're still trying to figure out what's in these records and kind of cleaning them up and trace, because there's some people that we have prenatal records for and not a delivery, some that we just have a delivery for. So we're just kind of trying to understand. That could be easily explained by perhaps they just weren't in the area when they gave birth, so they gave birth somewhere else, or, you can imagine. But the plan is to be able to use these electronic medical records at least to collect two kinds of outcomes. One is hypertension. So we have both diagnoses of hypertension, but we also have blood pressure readings for any visit that they had. So we're looking at how to use those together. We also have medications, so we could look at medications. So we'll be trying to design measures of hypertension from those. And we're interested in C-section delivery, since we know there are some racial, ethnic, and economic disparities in who has emergency C-section delivery. So we'll be looking at that as well. And I won't be talking about those today. All right, so this is what EgoWeb 2.0 looks like. We have two screens here. And I want to walk you through the first few questions, because those are our name generators for the social network analysis. So on the left side here, it says, to start, I'd like to ask you about who's a part of your family. Who are the people you consider to be significant living family members? This may include family members who sometimes make you angry or upset. They could be any age, related to you or not related to you. You may be connected to them by children you have. So we were trying to keep this as open as possible because part of the goal here is to understand who will they nominate as part of their family. But you can see, we care a little more about some things. So first, we insert the prompt about could make you angry or upset because we didn't want significant to read to them as like positive significant, but that we would try to encourage reporting of maybe some more difficult relationships. We mentioned they could be related to you or not. Age is in there. And then we have this last sentence, you may be connected to them by children you have, thinking about these complex families where people, multi-partner fertility, linked in different ways through children. So they would tell the interviewer these names or initials, and as the interviewer types them in, they start filling in that names list there on the right. Then the next screen pops up and it says, who on this list currently lives with you at least one night a week? And so you see the same 3 names that they nominated as in their family pop up over here and select. So this is how most of the questions about the alters get asked, where you see a full list of who you nominated as in your family. And then you get to say either yes, no to some kind of characteristic, or some of our questions have more response options, but that's to give you a sense visually of what this looks like. Then we had another name generator because I'm interested in this difference between what do you get if you ask people who's in your household as opposed to who's in your family. So I wanted to make sure to capture anyone who's in their household who they didn't nominate as part of their family. So that's what this is asking for. And you get a list of those names and we get a few details on them. We don't go and ask them all the questions about relationships and exchanges and all that, but I just wanted to make sure we knew who was in the household. And then we follow up even more to make sure we're getting all the children. So we ask, you told us about who's in your family, you told us about people in your household, and, on top of that, are there any other children and that you didn't mention, so that we make sure we have a full accounting of children. So a little bit more about the open-ended follow-up interviews. We used a flexible quota sampling strategy where, again, just like with the survey, we wanted to make sure we were getting different types of people that get selected to do the open-ended follow-up, so we can look at some variation across different categories. And we just sort of followed this as we went. We actually just trained 2 of our, I think in total, we had about 6 interviews across the life of the project. And we trained 2 of them in doing these interviews as well. And so at first we just assigned whoever ended up in their queue for an interview would get recruited to do the longer interview. But then as things moved on and we paid attention to the demographics in who we had already interviewed, then we started prioritizing, like, okay, we need you to now just only ask to do a longer interview if this person is, like, we had some combinations. For example, at some point we started saying we really need, if it's a white participant, we need them to have a high school or less than high school, because we had so many more with college or beyond a 4-year education, that kind of thing. We used a semi-structured interview guide for these follow-ups that mainly focused on the first question was, we asked you who was in your family and you gave us that list of people, who popped into your head, but you didn't put them on the list. So we were trying to get kind of near misses on family. Then we cycled through a set of questions that were designed so if they didn't mention certain relationship types, like if they hadn't mentioned a mother or a father or siblings, or we had different categories, different relationship types, the interviewer would ask, so you didn't mention a mother, do you have a living mother figure? And then if there was, kind of ask questions about why they weren't included and nominated as family, to understand a little more systematically, if we were missing certain types of people, why might that be? And then the final set of questions was just more open-ended, general. Tell us about what you really like about your family. Tell us about what's really hard about your family, just as an opportunity to perhaps discover different dimensions of family life that maybe we hadn't asked about in the survey and what might be important in these pregnant people's lives at the moment. So these were also on Zoom and recorded. We used the transcriptions you can get from Zoom, which were pretty high quality, but for each one, we assigned a research assistant to go in, put on headphones and listen to the recording at the same time, looking at the transcript and correcting any mistakes or clarifying things, doing a bit more formatting to make them easier to read and so on. And then now we have them all cleaned and de-identified as much as possible. And we're analyzing them in Deduce, a platform for qualitative data analysis. And first we just sort of open coded and read through these multiple times as a team and had meetings to talk about what seemed to be common themes that we're seeing. And after that, we decided on a code book that we then had research assistants go through and systematically code certain codes. A lot of them were kind of topic or descriptive codes. For example, we wanted a code that would show us anytime someone was talking about a family member who they sort of considered to be family but hadn't listed, so we can go back in and pretty easily sort and find different types of family members and what they're saying about them. We also have a code for sort of positive aspects of family, negative aspects of family that could happen at any point in the conversation. So this is a picture to try to give you a sense of what kind of data we might have picked up across the name generators. It's a little bit of an unusual case in some ways, but it's helpful because names came up in all of the name generators. So you can see first, who are the people you consider to be significant living family members? And they gave us names of 3 children. And then anyone else who lives in your household, there's a former partner there. And then any other children, and we get 2 stepchildren. And then the open-ended follow-up, who else did you think about but not list? And we get mother, father, stepfather, brother, ex-boyfriend, boyfriend. So it's telling, and we ask about each person that they list here and get a little more detail on who these people are, so that maybe in the future, if we want to pick up, like, I'm still very interested in doing a better job of picking up people that they have children with, former partners that they have children with, which ended up not being a very common nomination in the general family nominator. And a quick sense of the kinds of data we collected about alters, family alters. We have the relationship to ego. We asked them to identify who in that list. It's usually one person. I think it might have always been one person, but we asked it vague enough that they could nominate more than one person who is also a parent figure to this child they will be giving birth to. Do they live in the same household or not? And if not, the travel time between to get to where they are. The frequency of interaction and how well they get along have stars by them here. These are the only 2 questions we asked the ego to tell us about every tie in the family. So we know the frequency of interaction and how well people get along in each dyad from the perspective of ego. We didn't interview any of the other nominated members of the family. But then all the other information we have about alters is about the ego alter tie for all these alters, right? And so a couple of things, well, several measures, we have this bidirectional. So for support, emotional, instrumental, informational, we have who on this list would give you this type of support, and who on this list would you be likely to give this kind of support. We have a question about equity. If they are both giving and receiving support with a particular alter, we ask, who tends to give more support or less support, or is it equal? We have an interesting question that I can't wait to use, where we asked for each alter, what was their reaction when you told them that you were pregnant? And some of them said, I haven't told them yet, but most of them had. And so we get, it's highly skewed towards they were excited for me, but there is some, they were not so excited there. And then demographics about the alters. We have age, race, and ethnicity, gender, education, and then some health. We have an overall, like how good is their health from the ego's perspective, and then tobacco use, e-cigarettes, drug and alcohol use as health behaviors. All right, so let's look at some results. First, how do pregnant people self-define their family networks? So here is the distribution of number of family members that they gave when we asked them to list all the significant family members, ranging from 0 to 15, because we cut them off at 15. We didn't go higher than 15. So some of these people would have listed more than 15, but so you can see the mean, median, mode around 7, and the 3 highest bars, 5, 6, 7. So we are getting a lot of reports, family sizes in that range. I also want to show you when we look at just the family alters who were nominated who are 14 and older, because for a lot of the support questions, we only asked them of alters that were 14 and older because it didn't necessarily make sense to ask about young children. What types of family relationships did we get? This first column in the middle here is the percent of respondents who listed at least one of these types. So we get 80% listing a spouse, 14% listing a partner, 51% listing bio-adoptive children. So I think, I forget the exact percentage, but I think the largest group in the sample is pregnant people who this would be their first birth. So not everyone has other children, but when they did, they were pretty commonly listed, and a little bit there for stepchildren. Other larger categories, you see bio-adoptive parent happens quite often, siblings, parent-in-laws. 48% of respondents named a mother and or father-in-law. Also 34% listed a spouse or partner's sibling. So the in-law connection is pretty frequent in these nominations. And then some of the more general categories down below, extended kin, about 35% name. This would be grandparent, aunt, uncle. And here I'm counting both related by blood or through marriage or partnership. And formerly related kin, we get about 14% of people naming. It's not so much partners. It's more likely to be sibling in-laws or former sibling in-laws or former parent in-laws. We only had a handful of former partners nominated. And then social or fictive kin, about 10%, and these were largely friends that they felt like were family. And the second highest category were godparents. And then you can also see here, like, of the alters who were classified as a spouse, 99% of them are co-resident with ego. So that's what's showing here is, you know, not surprising, these spouses, partners, bio-adoptive children, and stepchildren are most likely to be co-resident with ego, and much smaller numbers when you get out in the family. So not a lot of kind of extended family households. It's more if you have extended family listed here, they're maybe nearby, maybe far away, but not in the household. So who's in the household but not listed as a family alter, since we had that name generator unfolding? So just 8% or 33 of the 412 participants listed a household member who was not named in the family name generator. And a large part of this was young children. And so we really did learn that even though we said that family members could be any age, a lot of people were kind of resisting naming young children because they weren't necessarily thinking of them as significant family members in terms of their interactions with them, their exchanges with them. So an important takeaway from this is thinking about to what extent you want children of all ages in this family network, and if so, how do we better suggest to a participant that that's who we kind of expect to be on the list. Some extended family or unrelated sort of roommates in the household, but not considered a family member. And then children being missed. So this is a combination of children that came up either in the household name generator or the one that followed to get any other children who might not be co-resident. And this is showing by age the number of children who came through these other name generators, not the family one. And you can see blue is biological or adopted. So those are really young children, again, that they're just not, they're thinking, I'm gonna just name sort of adult family members. And then red is stepchild or child of spouse or partner. And that has a wider distribution, probably because these older ones, aren't necessarily co-resident, but they didn't think of them as family and they're not in households, so they only come up here. So it's interesting to think about like what types of children we want to pick up and how we would do that better in a sort of setup to a question. Now I'm going to talk a little bit about the qualitative data, other potentially missed family members. So this comes both from when you were thinking about your family and you told us names, who did you almost tell us, but you didn't, but also the systematic, like, oh, you didn't mention a mother or father. And we got a lot out of this. So 96% of the participants who ended up with this open-ended follow-up named at least one person who, if you pushed, they would say, well, maybe kind of sort of family. And it ranged from 0 to 40 that they told us about. The median was 4. And I have stars by fictive kin and other family, because those were most commonly the types of people we were picking up here, where they really kind of struggled, like, my friend, I really feel like my friend's part of my family, but I'm not going to say they're a family member. And then other family, they're kind of thinking about like, how significant are they in my life or not? And so in this case, people we missed just didn't quite meet their bar of what they were thinking about as significant. I just grabbed a couple of quotes to give you a little bit of sense of what we're seeing in the qualitative data. The 3 main reasons that these were near misses. One is this, it turns out it's not just researchers that are really tying households up with family. And so we got a lot of reports of, well, when I think of family, I think of the nuclear family, like the family that you come from, the family that you created at home or grew up in the same home as. So that's why I didn't list my step siblings or my aunts or cousins. The second main reason here was distance. So our families don't live close by. So like our friends are kind of like that surrogate nearby family who can help and step up, etc. So they're thinking significant family members are closer, are more involved in providing support. And then third, this is one of the more interesting kind of surprises that, to be honest, we hadn't thought a lot about, but we should have. There's a developing literature on family estrangement. And so we were surprised, especially for the questions where we started probing about certain types of relationships that weren't mentioned. We started getting a lot of stories about family estrangement. So here, my younger sister has a drinking and drug problem, and I've had to set a boundary and just not talk to her anymore. It breaks my heart, but I do it for my own well-being. I've had to cut off contact for her. So when we ask her about significant family, she's like, nope, I've put a boundary. That is not a significant family member. But clearly she's saying her heart breaks. Like she thinks about this person. She's sad that they don't have a relationship. When we're looking at family health, we probably need to know about these connections, these family ties that are broken, and so might not come in a social network unless we think about how to ask specifically about these cases. All right, so then what can a family network approach tell us about families? So these are some descriptives to say, like, for our participants, the family networks that they told us about, what proportion are in these categories on average. So they're about 50-50 in terms of male, female. A pretty high proportion live within 1 hour. A very high proportion interacted within past 3 months. And then I've split them as well. I don't have time to go through everyone in detail, but I also looked, if we just looked at the co-resident component of a family and then the non-resident component of a family, the point of this was to say, actually, there's still a lot of help coming, in some cases, more help coming from the non-resident family members. Help, or also we have measures of negative interaction. So how often someone annoys or is annoyed by a family member, angers or is angered by. And we have a question about who provided information, advice about your pregnancy and how satisfied were you with that advice. So what we're looking at here is like the proportion that provided satisfactory advice about pregnancy. We could flip it, I guess, and look at, you know, who provided advice you didn't want or thought was bad. So then let's look at how it relates to prenatal distress. So we have this prenatal distress index. At this point in your pregnancy, are you feeling very, a little, or not at all worried about? And then a bunch of different questions about taking care of your baby, medical care, relationships, health, delivery, paying for things, etc. So we averaged this out as a measure of distress during pregnancy. I'm not going to talk as much about, we have the CESD measures to look at depressive symptoms. Here's some descriptives. I want to get to the results quickly. If anyone has questions about descriptives, we can come back to this. But here is some results for distress. So first, the first three models, we're looking at these sort of classic social network measures. Density and transitivity both get at kind of how connected are members of the family network to each other. And number of components is the third one. It looks more at fragmentation. So how many isolated groups of people do we have in the family? First, I will say, not surprisingly, it's difficult to get variance in these because it turns out members of families know each other and interact with all of each other a lot. So we've really set the bar high here. We say we're looking at frequent contact and close ties. So it's not just who knows each other, it's who interacts a lot and gets along well for density, transitivity, and number of components. And I put them in separate models here because they're highly correlated, especially density and transitivity. So we're still kind of working out and figuring what makes the most sense to sort of pull from a social network perspective in terms of these global measures of the structure of families. But, you know, we have density and transitivity. The higher those are, so the more connected the network is, the lower distress during pregnancy. Number of components, which is fragmentation, is opposite sign, right? So the more fragmented the family is, the more distressed our respondent is. Then we look at emotional, instrumental, and informational support. I went ahead and put them all in one model because it was going to be too wide of a table here. They are statistically significant on their own in a model. And by the way, these have typical demographic controls. Also, I'm controlling here for the relationship status of the respondent and whether it's a first birth. So kind of getting at some elements of family structure to see over and above that, what do we see in terms of network dynamics and interactions. But anyway, when you have all three support together, it's really emotional support that's showing up negative and significant here. And then I added in the negative characteristics of ties, so the proportion in your family network who annoy, anger, upset, or are unpredictable. And there's really a lot more going on, hanging all together when you put them in the same model here. Again, these are sort of initial runs, just sort of seeing what's here, but we have a lot to explore in terms of what's correlated, what makes the most sense to put together. But as these negative kinds of aspects of ties go up, there's more distress, and you're seeing more statistically significant, at least right now, for the more negative side of ties when it comes to distress. I will say for depressive symptoms, it's more the upsetting and unpredictable nature that seem to increase depression. Anger and annoy, not so much as they do here. But it's a similar story with the support measures and depressive symptoms. So conclusions, future directions. I want to get to questions and feedback. So we can capture complex family networks with a survey and learn a lot, but we really need to think about how we want to set this up and what we want to ask people and what we want to probe them to give us in terms of a network and who's in it. Be explicit about children, really think about how we might better capture former partners, and including estranged family members. And the family network measures seem to be working in expected ways in the multivariate models and telling us over and above relationship status and having had a child before both remain significant in all these models, but over and above that, we're seeing family networks matter. Next steps, I mean, there's so much data here, and so we have the positive and the negative, and I want to start looking at ambivalence here. So I'm thinking about perhaps going towards some person-centered analyses, maybe some latent class analysis that might allow us to develop profiles of families and networks in terms of what kinds of people you have in them and what the structures of them are. And then looking forward to getting the electronic medical record data ready to look at different kinds of outcomes from those, and also seeing how feasible it is. As I mentioned, this was funded by R21 to both see, could we make progress by using the family network method, but also what do we, would it work to try to get a more kind of general population type sample, but also have access to their medical records so we didn't have to necessarily go back and interview them about things that happen in the delivery and so on. Okay, that's a lot, but thanks again, and I look forward to questions and comments that you have.